Hi guys, welcome back to the channel Neenus Basic Life. Today I'm going to talk about medication named aspirin, which is also known as acetyl salicylic acid. So here are some things we're going to cover. We are going to learn what's the mechanism of action of this medication, why is it given to the patient, what are some side effects that we need to be aware of, and what are some nursing considerations also before giving this medication. And also practice questions are at the end for you guys to solve, and there is a given answer key at the end too. So let's start. This medication belongs to class NSAIDs and antiplatelet. It's also antipyretic and non-opiate analgesics. So okay, all these big words. Now, what does aspirin do in the body? So let's see. What is that is it irreversibly inhibits COX-1 and COX-2 enzymes. Why these enzymes? Because these enzymes produce prostaglandins, which are responsible for inflammation, pain, fever, and platelet aggregation. So these medication such as aspirin, so this medication is given in low dose and also in high dose. If it's given in low dose, it has antiplatelet effect. Okay, what is antiplatelet effect? What it does is it blocks COX-1 and COX-2, which reduces production of thromboxane A2. Why thromboxane A2? Because it's responsible for making platelets stick together, which is platelet aggregation. So aspirin prevents these platelet aggregation and reduce risk of blood clots, heart attack, and stroke. If it's given in high dose, it's for anti-inflammatory, analgesic, and antipyretic effect. Now, let's go over why is it given to a patient? Why does a patient need it? Mostly it's for heart attack prevention and stroke prevention. So in patients who are at risk of clots, for example, if the patient already had a stroke, then we know stroke is caused by the clots formation. So now aspirin is preventing these clots because the platelets are not coming together, not forming that framework, meshwork at the injury site. So now the blood is free to move. That's as simple as that. Now, what are some side effects? Now we know the patient, why the patient is taking it. Okay, the patient doesn't need any clots. So, what are some side effects? Assume there is a normal person. Hey, if he has a injury at the site, it's gonna bleed, but when it's bleeding after some time, it's gonna stop because there will be a framework or fibrin meshwork at the injury site, which is like stopping the blood flow. So, but now this person is taking aspirin. So, will this happen? No, because there are no clots forming. The platelets are not sticking together. They're not coming together to stop that blood flow. Now, there is excessive loss of blood flow. So, this is the major side effect of this medication because the blood is moving so smoothly that there are no platelets aggregation. Platelets are not stopping the blood. Now blood is all free to move. So now when we're talking about bleeding, so it's not just GI bleeding. Of course there is some GI bleeding. How are we gonna see that there is GI bleeding? We can check the stools. So if it's bright red or dark red, if it's bright, it means it's a fresh bleeding occurring from lower GI tract. Or if it's old blood, dark blood, and it means it's from upper GI tract, we can figure that out. Or what else? Are there some reasons? For example, if the person has chronic nausea and vomiting and the patient is vomiting, so we're gonna check that emesis. We're gonna do coca, color, odor, consistency, and amount. We are going to check if there is presence of blood in it, and if yes, how much is it. And also we are going to check epistaxis, if there is any kind of nosebleed. So bleeding from anywhere, from nose, from mouth, from GI, from GU, in urine, we're gonna check all the sources. Okay, so let's assume now this person doesn't have bleeding from anywhere. Can this person still have bruising? Yes. So now we are going to find out the reason why the person is having bruising. Is it because the person hit something? So we are going to check that. Another, let's move forward. And the toxic effect is tinnitus, which is ringing ears, which is indication of toxicity. We are going to monitor that. And now we know why are we giving the medication, we know what are some side effects. Now, what are some contraindications? As we were just talking about active bleeding, so if you go into the patient's room with your medication, now you see the person is having nosebleed. Are we going to give the medication? No, we are going to hold the medication, put pressure, and then try to stop that bleeding, monitor the patient, and then we're not going to give the medication. That's our nursing judgment, and we can always follow up with the doctor in situations like these. And then another indication that I've highlighted is taking other blood thinners. So because if the patient is on multiple blood thinner, it increases the risk of bleeding. So of course the patient can be on multiple blood thinners. So are we going to tell the doctor, okay, just do one blood thinner? No, we're just going to monitor the patient closely. We're going to check the patient's lab, what are the patient's CBC, PTT, INR, how's the vital signs, how's the respirations, and we're going to check all these nursing assessments we're going to do. So checking that. And also if children have viral illness, then we're not going to give this, because children has risk of developing Rees syndrome. Let's move ahead. Again, bleeding. So before giving the medication, we're going to check if the person is bleeding, and then we're going to review the labs, and we're going to teach the patient to report any signs of bleeding, and then not to mix it with alcohol or other NSAIDs, and take with food to reduce GI upset, and provide small frequent meals to relieve GI discomfort. Another important detail is stop taking aspirin 1 week before any major surgery. Why are we stopping it? Because if the person is having surgery, then it is sad that person will have some bleeding. But if the person is on aspirin, then the person is going to lose a lot of blood, because there will be no platelet aggregation, there will be no fibrin meshwork at the injury site. So we don't want that. It can lead to loss of blood, and then we are not going to go for that. So that's why before surgery it's advised to stop taking aspirin. And its antidote is sodium bicarbonate. Here is some review of this medication. Again, it's an NSAID, and we are going to watch for any GI bleeding, bruising, any tinnitus, and specifically checking for patients' lab values. Here are some practice questions. You can pause the screen, take your time to do the answer, and then move on to the next question. So here is the first question, then here is the second question. Just pause the screen, take your time. Here is the answer key. I hope you guys are better able to understand now how aspirin works in the body, and I tried to make it as simple as I could. And if there is any review from you guys, I would love to have any feedback, and we can continue with another medications too. Let me know which medication you want me to review next, and that's it. Until then, review the video again, practice questions, and make sure you have your doubts clear. And please do not rely on this video as your only source of information. I have pulled the information from nursing textbooks and also from drug guides, but of course if you're not satisfied with this video, go ahead and do your own research as well. But I think this will be a good start for learning about this medication and knowing how does it act. But okay, enough talking for today. Okay, so now bye bye, take care, and I'll see you next video.